Getting our children to eat healthy is always a challenge. What are the foods they should be eating? We spoke with Tiffani Ghere, a registered dietitian at Children's Hospital of Orange County, for her best advice for kids to eat healthy.
My best advice for feeding kids would be to go to the first source, use a whole food. And the foods that are going to have the most nutrition are going to have the most color, and they're probably going to be plant-based. That is our big resounding message right now in nutrition. So if a parent asks me, what's the easiest way for me to feed my kid good food? I'd say, go to the source of how it was grown. If you take an apple, you pick it from the tree, you wash it, you eat it. Very simple. If you look at a barbecue potato chip, they had to pick the potato, they had to peel it, they had to mash it up, they had to make a paste, they had to extrude it into a chip, they had to fry it, and then they had to concoct some kind of chemical barbecue type powder and blow it on there. They had to preserve it, and then they had to package it. So when you look at the number of steps of processing, it's very far away from that original potato. So nutrition can be really, really simple if you go back to its most basic form. Our message has always been more fruits, more vegetables, eat whole foods. And what we're really finding now is we have the evidence that's showing not only we have all these scary diseases that are impacting our children and our lives, but we also know that people are craving healthy food. They want healthy food. And now what we're seeing is a collaborative effort where I as a dietitian can rely on the skills of a chef to help me provide food that tastes wonderful. I can help the chefs promote their message while they're out doing what they're doing. They can learn more about nutrition and be teaching as they go. And our medical physicians, our residents are getting residencies in nutrition now. We are giving them more tools in their toolbox to take so that any intervention they have with a patient, with a family, they can weave that message of nutrition and good food in there. Recently, they rolled out the Choose My Plate campaign, which replaced the food guide pyramid. And if you look at that plate, you'll notice that 50% of it is fruits and vegetables. So we really know that we need to beef up our plant-based foods to combat these problems of obesity and disease that we're seeing. And the portions of dairy and grain and meat or protein that we need are actually a lot smaller than we realized. And so these guidelines are trickling into how we're serving lunches in the schools. And it's a big task to undertake, but our kids are worth it, and we're seeing success. Our resounding message in nutrition is fill yourself up with those fruits and vegetables, things that will fill you up, and you can still have the flavor of the rich, sharp cheese or the pepperoni. You just don't need as much of it. And if you can think that through, you can still have a really tasty meal without compromising your health. You want to try and push their boundaries and try to get them to try different variations of the things that they like. You can use things like dips, guacamole, salsa, bean dip, which have lots of nutrition in them, and then you can get them to try to dip things in these things and try a jicama or try a bean sprout or a sugar snap pea, and you can have little successes that way. The biggest message to parents who get so tired of being rejected, I put it out there, they refuse it, I put it out there, keep putting it out there. It's worth it. Try new things, get them involved with the preparation and the cooking. Kids as small as 2 can help you in the kitchen if it's setting the table or helping you snap the peas and get ready to cook them. The more involved they get, the more they learn. They learn about food, where it came from, how you cook it, what it does for their bodies. Because ultimately our goal as parents is that we raise healthy little people that are empowered, that can take care of themselves and own their own health.
As parents, we always want the very best for our children, and nutritional foods help kids grow up healthy and strong. For the American Health Journal, I'm Laura Windsor.